on the show, which is Rainbow Children's Medicare. It reported a steady Q3 set. Revenue grew by around 10%, and the average revenue per operating bed also improved by 14% on a year-on-year basis. We have Dr. Ramesh Kancharla, who's the chairman and managing director of the hospital. It's a pediatric hospital. It's present in around 6 cities and 17 hospitals across the country. Hi, doctor. Thank you very much for joining in. Well, before we start talking about the average revenue per occupied bed, which has done well, just wanted to understand the occupancies which have dipped on a Q-on-Q basis. What is the reason for that? Is that because there was a festive season and hence maybe the footfalls were lower?
Very good afternoon, Ekta. So what has happened this year is that, what we seen is there's seasonally quite a muted Q2 and Q3. Normally we expect this Q2, Q3 to do very well. So because of the heightened outpatient footfalls as well as the inpatient admissions across the board. So that's not has happened because of the late monsoon, and also it's been rather irregular, and also some cyclone effect in Tamil Nadu and Andhra Pradesh. These are all the reasons that we have kind of seen fairly kind of a flattish growth in the Q2, Q3.
All right. Doctor, could you give us a sense of the average revenue per occupied bed? We saw 14% rise year on year. What resulted in this rise? Could you explain what the case mix was? And tell us what the outlook for the next couple of quarters is in terms of both occupancy and average revenue per bed?
So normally we expect kind of our ARPOB growth will be about 6 to 7%. So this has gone up. One of the main reasons being because there's a muted seasonal business. That's the main reason. The second important thing is all other kind of high the revenue per day, like a kind of obstetrics and pediatric critical care and newborn intensive care, and also the pediatric specialty business, which has done well, plus a shorter ALOS. Combination of these two things together, it got pushed up to the 14% ARPOB growth. I think in a normalized year with a kind of a more of seasonal business Q2, Q3, this would have got moderated.
All right. And occupancy?
Occupancies have definitely have gone down significantly because of the seasonal kind of relative low performance. And as we see what is a Rainbow Group, I think we do a kind of year on year we keep adding beds about 150 to 200. This current financial year we're kind of on course to add about 280 beds. So with the consolidated, the addition of the beds, so we expect our kind of occupancies around 55%. This is what in annualized occupancies with the matured as well as new hospitals. Matured hospitals usually kind of expect to be kind of 60% plus, and the new hospitals would be about 40% plus. So that's what actually we expected our business to be.
Okay, all right. So maybe occupancies for mature hospitals would be, or maybe on a consolidated basis, occupancies would be around 55% on an annualized basis. Doctor, I just wanted to understand that the amount of money that you're now getting from insurance has risen to around 50%. What does that mean for business? Does that mean that there are more higher end surgeries which are taking place, and hence maybe that would be beneficial to your ARPOBs as well as your margins in the longer term?
I don't think insurance, the business will push up the ARPOBs. It's a kind of quality of the business which push up the ARPOB in terms of kind of more of a IC, intensive care business, obstetrics, as well as kind of a quaternary care. So we've been doing quaternary care, something is nascent, which has been growing quite significantly. That's actually adding significant revenue on to push up the ARPOB.
Okay, but what is the trajectory that you expect in terms of the mix when it comes to insurance versus cash payments?
Yeah, I think at the moment we are at 50-50%.
Yeah.
So I think it's pretty healthy at 50% of insurance. As we for the cash flows and all those things, though we do not do much of government business, it's a more of a kind of insurance of third-party insurance companies, the very minimal of government business. So I would prefer to be kind of a 50% or 55%, 45% insurance versus cash.
So all things said and done, Doc, if you could tell us, the first 9 months revenues have been up by almost 12%, margins around that 34%, pretty stable as compared to the same period last year. What are you likely to end this year with, and any early indications on what FY25 could look like on both the revenue and margins front?
I think this year kind of would go in the similar lines, what the so far year gone. Since there's a lot of beds being added in the geographies where we kind of have a strong presence like Hyderabad, Bangalore and Chennai. So next year, probably kind of a big year for us in terms of executing our business plan in these geographies. I would expect it to be a good 24-25.
Okay, just before we let you go, I just wanted clarity on two things. One is medical tourism. Is that an area that you're probably going to focus on because you have other capacities which are coming up? And your new Hyderabad facility, which has just come up, I think it's in central Hyderabad. How exactly is that doing?
It's one of the spoke actually. That's a one large area which Rainbow is not been present. I think we covered that area also. Right now we have about close to 900 plus beds in Hyderabad city with 7 spokes and 1 hub hospital. I think we probably kind of covered Hyderabad very well at the moment with hub and spoke model. And similarly that in Bangalore, we're kind of expanding our hub and spoke model, as Chennai as well.
Right. And inorganic growth, I remember had earlier indicated that you're looking at a couple of assets in the western part of the country, some in the eastern part as well. What has materialized so far?
Yeah, we continue to look around, evaluate those things. Probably kind of hopefully I will give you some news in the couple of quarters.
Okay, all right, sir. We're going to leave it on that note. Thanks very much for joining in and speaking with us. So that's Rainbow Children's Medicare talking to us about the quarter gone by. They do expect annualized occupancies to probably be at around 55% odd. Generally, they do see an ARPOB growth of around 6 to 7% odd. So let's see how that pans out for them. Insurance cash mix should be 50-50. We'll take a short break. On the other side, we'll be talking to the management of Mass Financial Services. Do stay tuned.